Thank you for inviting me to talk with all of you this evening and to share the power of listening to patient stories and communicating as a doctor and communicating to others in everyday life. I, like the last speaker, had the privilege of hearing the stories of my great-grandmother through my grandmother. My great-grandmother was a midwife in the East End of London in the late 1800s. My grandmother, the second youngest of 13, born in 1898, sometimes went with her mother to these deliveries. One of the stories she liked to share was running through the streets of Hackney, which is in the East End, to get the doctor for the delivery if it was more complicated than a midwife could handle. The best part was bringing a healthy baby into the world and the horse-drawn buggy ride back to the laboring woman's home. And there was always a cup of tea and a biscuit, and of course, lots of chatting. The war years, 1914 to 1918, were devastating. So many lives lost, and so many lives changed forever. But babies still came into the world, and lay midwives like my grandmother and my great-grandmother played a great role in bringing these babies into the world, and their stories still needed to be told. My mother was born in 1930 in London, and again, as we heard from the last speaker, another war was coming. My Ukrainian-born father was a doctor in the United States Navy, and his World War II service took him to the East End of London, where he did meet my mother. He'd gone through medical school in 3 years instead of 4, and interestingly, a lot of medical schools now are going back to the 3-year curriculum as opposed to the 4-year, because there was such a huge need for physicians for the war effort. Before coming home, he gave my mother a one-way ship's passage from England, bombed up London to New York, which was where he lived. And she was a war bride, and he started his family practice. So Maya Angelou once said, "There is no greater agony than bearing an untold story inside of you." When I was young, I went with my dad, like my grandmother had done before me, on house calls. And this was in Southern California. My job when I was young was to carry his doctor bag, and this was a two-handed endeavor because I couldn't carry it with just one hand. And then I'd usually be sent to make coffee or tea or sandwiches in the kitchen while he tended to the person who was ill. When I was older, I went with him on hospital rounds and also to his office. Sometimes I'd be sent home at lunchtime with a bucket full of berries to make boysenberry or blackberry pie and bring it back for the evening office hours. On 2 occasions, which were especially exciting, I took home 2 Afghan hound puppies and another time 2 Burmese cats. I didn't go back for office hours that evening. I had the opportunity to listen to a lot of stories at the nurses' station in the hospital and also in the doctor's lounge. One of my first lessons in medical school in the early 1980s was listen to the patient, and they will tell you what the diagnosis is. So let's bring you up to present day, August 2025. I was attending a Mayo Clinic continuing education conference. The state of California requires that we do 50 hours of continuing education to stay up to date and to maintain our medical license. And one of those lectures was given by Dr. Larry Bergstrom. He emphasized the importance of patient stories, especially in complicated medical conditions and in medically unexplained symptoms. I think my great-grandmother, grandmother, and father would have agreed with Dr. Bergstrom. I definitely sat up and actively listened. Dr. Bergstrom told all 800 of us who were in that auditorium about something called narrative competence. This is the ability to acknowledge, absorb, interpret, and act on the stories and plights of others. This improves the health of the patient and the empathy and compassion of the clinician. So where's the science? Interpersonal neurobiology is the essence of this, and it is feeling understood. When you think you understand, you often stop listening. I hope you never stop listening. Especially when we talk about medically unexplained symptoms, symptoms that overwhelm and incapacitate the patient, causing multiple doctor visits, going to multiple physicians, so many tests and still no answers. I saw in my own practice that this was often because nobody really listened to the patient. In 2022, Dr. Gabor Maid came up with something called compassionate inquiry or active listening techniques. These apply to doctor's visits, but are also important in everyday life. Active listening includes 7 concepts. One is being present in the conversation. 2, showing interest by good eye contact. 3, noticing nonverbal cues. 4, asking open-ended questions. 5, paraphrasing and reflecting back. 6, listening to understand. 7, withholding judgment and advice. I think I've used these techniques every day in my practice with my patients and with other people. The noticing nonverbal cues makes me think of a patient during the pandemic. I had taken care of her parents before her, and both she and her twin sister. Her parents had really complicated medical conditions and spent a lot of time in and out of the hospital. And Christina sent me a MyChart message, a typed communication between a patient and a physician or patient and healthcare team. And she said, this is March 2020, so right at the heart of the pandemic. She said that she thought she had food poisoning. And maybe if I hadn't listened or read between the lines, I wouldn't have ordered a whole bunch of blood tests, but I did. And they were abnormal, and she had what I thought might be something infectious, but turned out after the ultrasound and CAT scan, which were done that very same day because we were all in lockdown and nobody was doing routine screenings or any routine testing, and she had a large pancreatic mass. Dr. Kilcarney, who was our pancreatic surgeon at St. Jude, he wasn't doing anything either because we were in pandemic lockdown mode, so he came over to the hospital and removed her tumor. And Christina is very much alive and doing really well, almost 6 years from when she was first diagnosed with a cancer that's usually life-threatening and life-ending. So listening sometimes and reading between the lines sometimes does have profound implications. Much of what I learned from my grandmother, the midwife, my father, the doctor, my professors, my friends, but mostly from all of the patients who I had the privilege of helping. As Hippocrates said, it is more important to know what sort of person has a disease than to know what disease a person has. May you truly listen to one another. May you always feel heard. May you find compassion and kindness for all. Thank you for listening to my story.